Now we would like to invite Minister Fernando Leal da Costa from Portugal to hear some important points that they are working on for prevention of obesity in Europe, in Portugal. Thank you very much, Minister, to be here.
I don't need that much. Right. Good morning. Thank you for the presentation. Thank you for having invited me. It's a pleasure to be here again in New York. Well, I'm going to present a few slides, actually only two, and I'll let you know of the things we've been doing. I brought something to read in order not to forget the most important things to say. Now, right. Well, we have traditionally a healthy diet, and what we present here is that we are part of the people that normally have or should have Mediterranean diet. And as you know, we now have it as a candidate for the World Immaterial Heritage by UNESCO. And some of the characteristics of the Mediterranean diet, although we do not have Mediterranean shores, we are part of the Mediterranean people, so this is what we should normally eat. But we've got to confess that now, in spite of all of this, obesity is becoming a major concern and one of the biggest public health problems in Portugal. Using the WHO criteria, approximately 35% of children between the ages of 2 and 5 are estimated to be overweight or obese, and these numbers are seen later throughout childhood and adolescence into adulthood. And what we present here also is a nationwide projection of people over 20 that would be pre-obese or obese as the results of a survey conducted by the National Society of Nutrition Sciences, and it was done in 2009. So as you can see there, and considering that our population is around 10,000, it is a big problem that we should not forget. In Europe, as probably you know, costs with the disease are estimated to be equivalent to 1% of the country. So Europe and WHO has great commitment in reducing obesity in children and young people, controlling the growth of this epidemic by 2015. In Portugal is part of this. We do know that, and we've actually seen this morning, that obesity is determined and influenced by such factors as food availability, education and profession, and because of this, prevention measures often lay outside the healthcare system. And we, as other countries in Europe, are going through deep changes in our economy, and this is probably another challenge for us to monitor and see what would the consequences of the economic measures we are using to adapt and go beyond the crisis we'll have on the nutritional balance of our population. We do have a national health system with a variety set of health professionals that include doctors, nurses, and nutritionists, to name but a few, working mostly in healthcare institutions, but also with schools and municipalities, facilitating thus prevention activities. And we had a mention of our initiative called MUNSI with the municipalities. We know that education plays, in fact, a major role in prevention, and we are therefore working with the Ministry of Education on improving the quality of food available in schools, advising on school menus and regulating access to foods in our schools. As an example of joint initiative, we also we've been working with the Ministry of Agriculture in the distribution of free fruits in schools, and this is a way of helping to fight inequalities in access to healthy foods. Intersectoral work has also involved the Secretary of State for Sports and Youth on promoting physical exercise in schools and elsewhere, and the food and agriculture industry, private companies and NGOs. But I would like to focus our attention on two initiatives that are probably the most significant currently in Portugal in this area. One is the Platform Against Obesity that was launched in 2007, and aims to facilitate development and sustainability of effective integrated intersectoral approaches to obesity prevention and control. In its goals and strategies follow international recommendation put forth on the WHO's 2004 Global Strategy on Diet, Physical Activity and Health and 2008 European Action Plan for Food and Nutrition Policy 2007-2012. Among other things, the platform proposes strategies to prevent and control obesity and monitors the impact of different strategies on the prevention and control of this problem. And the other initiative I would like to talk to you about is the National Program for the Promotion of Healthy Diet that was created as part of the current government's plan for health and started in January 2012. Its aims are to improve the nutritional status of the population, encouraging the availability of healthy foods and creating conditions for the population to integrate into their diet and their daily routines. The program's objectives include increasing knowledge about the food intake, modifying the availability of certain foods, particularly in school and work environments and public spaces, informing people about purchasing, identifying and promoting cross-cutting actions that encourage the consumption of food of good nutritional quality, improving the qualification and procedures of the professionals that by activity can influence knowledge, attitudes and behaviors in the food area. Most recently, we have committed in conducting a national service on eating habits, something we haven't done for some time now, and is a useful tool in terms of situation assessment and planning future options. Last May, we applied to take part in the second phase of the Pan-European Dietary Survey, targeting both adolescents, adults, and the elderly, and this survey will be sponsored by the European Food Safety Authority and is an effort to standardize procedures and methodologies across Europe so that when we want to access food intake, different countries will be using the same type of tools, making results comparable. We have, for the first time in years, between 2008 and 2010, an apparent stagnation in the process of this epidemic. So, to conclude, fighting obesity is a long-term investment, and we want you to all know that in Portugal we are very much committed, and we thank all the actions that EPOD have been conducting. Thank you very much.